the Canary Islands in Spain, where I'm in these days. Really great to see so many people in the webinar. This is the first webinar after the workshop in Tanzania. That was really a fantastic opportunity to see all of us in person and to discuss in depth some of the topics. And the idea of the webinar today is to do a deep dive on one topic that you all requested. So through the technical assistance mechanism, you have all requested support for the costing of the SRS implementation. There is another theme that has come out for all countries, probably is also sampling. So I'm envisioning another webinar in the next weeks around sampling. But today is about costing. And Malick has agreed to share with us the experience that they had in Mozambique in costing the SRS, and we had some discussion on how this could be useful for you all. They have produced an Excel template that I think would be super useful for all country teams in their effort to estimate the budget for the next 2 years, 3 years, 5 years, whatever you have decided that the SRS should be budgeted for. So yes, as a starting point, and I will pass it to Malick very soon. So to me, like costing or budgeting for the SRS implementation is about resources, of course, but it's not only about money. It's about what do you need in addition to what you have to fulfill your vision for the SRS, to make sure that the SRS produces whatever you think the SRS system should produce. And this idea of incremental cost to whatever you have or incremental resources is important, because sometimes, for example, you will probably rely on a staff that is already there in health centers or in health posts that they already are receiving a salary. So you want to capture, and so you will not need to pay them a salary, but these resources, you will need them to implement your SRS. So looking at this exercise as resources rather than just funding, and looking at it as the incremental to what the system already have, I think are kind of crucial for the costing that you need to implement. But we will probably have some more time for a discussion after Malick's presentation. So if there is no like burning question or issue, I would like to give the word to Malick to take us through the costing that they did in Mozambique, and then the template. I don't know, Malick, what if you want to show the template as well, the Excel template. But anyway, over to you, Malick.
So thank you. Yes, I will just go through a quick presentation for people to understand how we did the costing and why we based that on our previous experience. And as you mentioned, countries should look this as the template, and they can adapt it as their country needs. For some resources probably already available in country, they don't need to also use those ones. So let me share quickly my screen. So I hope you can see the screen. So we share with you the paper and the PowerPoint presentation in French or in English also, translated, so you can go through those as needed. So today I just present the costing exercise we did in Mozambique and how much it costs the COMSA and SIS-COVE system in Mozambique to run and implement it over the time period we were there. So most of you already know the COMSA system. This is just a brief description again about the main objective for COMSA Mozambique is to provide representative community epidemiological indicator related to mortality and disease. And also we call it cause of death at all ages. COMSA also, Mozambique or SIS-COVE now provide a sample-based demographic and vital statistics, and those are also linked to CRVS in Mozambique in one province for now. And also this platform also will serve and is serving for Mozambique as a platform for rapid data collection on specific diseases, and in particular integrated disease surveillance have been running in Mozambique for several years now. And it is now fully run by the government of Mozambique, in particular the National Institute of Health. So this is generally what we have in the COMSA Mozambique. Like it is like a random selection of 700 clusters, and they are representative at national and provincial level. Here, the number you are seeing here are the number of clusters we have in each of those provinces. Mozambique have 11 provinces, and you can see here, on average, we have around 300 households per cluster in Mozambique. And also, those are just giving you an idea on how the clusters are digitized in Mozambique. This is an urban area, and this is a rural area. Overall, we follow up around 800,000 people that live in 180,000 households. This is overall just the Mozambique setup. So after we run this project for 4 years, we wanted really to understand how much it costs to run a sample registration system using the Mozambique experience we have there. So this paper was published by our colleagues, Giovanni, Victor, Emma, myself, and Agbesi, really to go to a deep dive analysis of every single expense we have in Mozambique, which means the country that runs an SRS should really track all the expenses. So you can go through and read the paper. We share it with you already. But I just wanted to point out here the main objective of this paper was really to quantify the program cost of establishing, this is important, and maintaining the implementation of the COMSA Mozambique between the 4 first years of implementation of the project. There are other more outcomes that we produce in this paper that we wanted to do a unit cost or a cost per capita that give an idea on really how much this program will cost. But I will not go through this presentation about those indicators because here we just want to see the overall cost of the project. Later on, when countries start collecting some additional indicator, they can do more analysis as needed. But I will just focus on the first objective we had in this paper. So how we did it, the method was just because that project was funded by the first 4 years by the Gates Foundation through GHU, and GHU has to subcontract the National Institute of Health and the statistics. So we were asked or tasked to produce a quarterly and financial report. So which means the country in Mozambique has to produce every quarter and every year a deep, detailed financial report that was really kept here and analyzed for this paper. So overall, for this paper, we just have 2 costs. We just split the cost by 2 types, like how much really do we spend to like what we call the startup costs. Those are the costs that you want to put there to make sure your system is starting to run. So there we really wanted to really understand how much do you need and what are the resources you need to really make the system to launch the system. So you can see there, those costs are mostly related to the design, the initial phase, and also the phases that were done really during the first few years to have the system in place related to infrastructure, all those costs. Then also we look at really how much really do you spend what we call operational costs or running costs here, how much it will cost really to maintain the system in place. Those are related to mostly the what we call recurrent costs, like the salaries, field supervisions, maintenance of the vehicles, any refresher training, the dissemination events you want to have. So we just decided to, in this paper, to really see those 2 costs, and most of you will probably need first to start with those 2 costs to start the SRS. So overall, this is the result we have. So for the first 4 years of the project implementation, we spent around $5.8 million for the project. And you can see here, most of the cost that was like 35% of the cost, like around $2 million, was to really set up the the project, like the startup cost. And you can see here, we even have some costs really for what was the most line of the budget that costs a lot, because Mozambique is like a large country, like on size, and also we know our communities are really spread in each of those provinces. So one of the idea and recommendation was to put like some vehicle at provincial level for province team to reach quickly those communities. You can see whether you need that kind of expenses. If yes, you have to budget that. So you can see here we spend almost $800,000 for those costs. This is really 40% of the startup cost. And also there are some costs that are related to like the baseline population and household mapping and cluster mapping. So each of those SRS you will think about before even deploying those communities. After you select your community, you have to go redesign the cluster boundaries, ask about the population that live there, make sure that the cluster are really the household and the community are really defined before it starts. So that we, as you can see here, we spend almost like $250,000 to start this. And also think about technologies. What do you need? For Mozambique, we have like smartphone, tablet. We have also some printers. We have laptop, monitor. We put all those and put it at each province have their own technologies. They can monitor what's going on the data collection and also use those resources for program monitoring and field activities. And also we spend a lot of money for training, because training was done to bring all interviewer in the same place in Maputo and train them at the same time. So which means you have to pay those expensive costs. So you will think about really what you need for your costing and how you want to implement the project. So this is the case of Mozambique. So, and after we know that you spend that money to really make sure that all the physical infrastructure, the teams, recruitment, everything is in place. Now, how much it will cost per year really to run the system? And you can see here overall, the annual cost for running the system in Mozambique is less than $1 million. So we just put like an annual running cost about $1 million. And you can see most of those costs are related to paying people for data collection, like almost 50% of that, like 46% for just paying them, the provincial team to get their salaries, their RGM, and insurance, data collector, all this. And the other costs also might be related to a central level team, as Daniel said before. You can think about if the government is running this, if they have some people that are already in the government system, does not need salaries. So all those need to be think about and really put your design as your resources you need. So in Mozambique, we have to pay some external consultant, because when the project started, we used to see the resources they have, how we can build the team. So which means we have been paying some people to come and get some contract to work on the project. And also the maintenance of the vehicle. So think about if you use some vehicle, really every year you have to pay some money for all those ones. So overall, this is just the paper we published and have an idea on really if you want to start an SRS, like a community-based surveillance, how much it will cost you. Overall, as we said, about $6 million was spent, and almost 35% was really to put like the infrastructure in place to start the project. So I think you all will probably read the paper, then bring any question you might have. I wanted just to go quickly to that paper before we really go to deep dive on what we have in the system currently. I don't know why it's not moving. Sorry about that. Yeah, so this is in summary how much we spend. As you can see here, an annual running cost of the system is about like 1 million, and we wanted to compare those with some of the national survey that Mozambique did for their FIA project, like around $6 million was spent for those projects. And you can see that it is really not comparable, but at least that gives you an idea whether it is too expensive to run your system or not. So you can see whether you have your cost to compare with your country survey you have, either it is like a DHS or any national survey that the country have been running. So this is just a brief description of the paper we share. I wanted to start with this. Maybe people did not have time to read it, just to give a startup before I start here. So now we have to find resources. So we, as we discussed here and during our annual meeting in Tanzania, we have developed a website that is called the Vital Insight for Vital Action, Viva, where you can find most of the resources that we have in Mozambique to run your system. So if you log into that website, I put here the website, you have, it will bring you a website. There are many resources there, but today what we are interested in is you click here on get the tools. After you get the tools, what we require you is your name and your email address. And after you do that, there is just a link that will open here that said to that link to go to the website here. So that website, you can see there, this is where we describe our 12 steps. Our 12-step guide helps you really to see how you can develop your SRS and run it, even implement it and run some code to have your outputs. Everything is there. As we discussed here, from step 1 to step 12, there are all where really to start from building situation analysis or sampling that we talked about here. There are some resources there. So we already share some of those tools for you for the planning phase that can found here. But today we want to focus on the budget. If you go there, there are 3 templates of budget we're going to just open here to discuss briefly. So, and we're going to focus on those 2 templates, the fixed cost and the recurring cost that as I showed. So after that, I'm just going to go to the website. If you have it, you just go there. I hope you can still see my screen. So this is the website, and if you open this website, you can go to, the website is here, get the tools and register. As I showed you, then you come to that new website where you can get all the tools, and the 12 steps are here. So if you go to building a support, in each of those steps, you have all the resources you need by step, and even the sampling you click here, it will give you what you need. But today, let's focus on the building a support. Building support. If you click on this, it will run and give you, as I said, there is first this budget template. I'm going to download all of them. You can download all of them. They will be downloaded here. All of them are spreadsheet. Okay, I'm just going to open all of them. Then after we open them, I hope you can still see my screen. Okay, so just wait a minute. So this spreadsheet gives you the budget component we think you should think about for your SRS. So, sorry, it's still downloading. I don't need all of them here. So yeah, this is what I need for now. So this is just a summary of budget that we'll go through quickly, like about the long-term funnel. Think about people you need from central or national level, provincial and community level. If you are using community workers to collect the data, whether you need a qualitative research study, and who will doing it, all the logistics you might need, how to identify and recruit community health workers, think about training, what do you need, whether you want to start off training of trainers and decentralized training. So all those should be in the design of your project you will put there. About the cluster mapping we talked about, and baseline household listing, who will collect the data. Some countries might use already some nurses that are already in place to collect the data. So think about whether you need salaries for them or just give them per diem to travel, collect the data, depending to your system. And also travel for field supervision is really important for the central team and provincial team to do the activities. And something that really emphasized here is when you are designing your SRS, think about having an annual or biannual update of your population, really to make sure that you have enough resources to really send an external team to really go again and collect and complement and assess data quality that the community have been reported over time. This will really help you to do any adjustment you need in your in your indicators. So logistics, publication, and stakeholders. So this is just submitting if you have an advisory group, you want them to meet maybe twice a year or once a year, and also think about some decentralized meeting you want to have at provincial level. So all those are developed in the template budget that we'll go through. So the template, you will have like the startup cost. So for each of those templates, when you open it, you will have a first page that says README. This just give you an idea on what you will find in each of the sheet we have there. So we really emphasize that you can read and really understand what is there. As we said, this template helps organize and plan for fixed cost. Really, what you need to start the SRS. So for here, you can see what you will have here. This is just a summary of the budget. For each of those spreadsheets here, any information on cost you add there, it will come in this summary template. You can put your country, if your system has a name. For Mozambique now, it is SIS-COVE. Then for any of those spreadsheet here you have there, any information that you put there will be added here. And at the end of this exercise, you will have an estimated budget for your startup costs. I will go through quickly all of them or some of them so you can see what is there. For infrastructure, as we said, Mozambique used some vehicles, so you can say, okay, we need, I don't know, a country might say we need also to use the same approach because we want people to go from provincial level or regional level to communities. We want like, I don't know, 10 vehicles. And each of those vehicles, I don't know, might cost $45,000. So as you can see, any cost you add here, if I go to the summary, the cost is already here. So you will think about whether you need those vehicle. If you don't need vehicle, you can leave it blank. And also, you can just put a comment here. We don't have it. Why you don't need vehicle? You can put easy. I don't know. It's just easy reachable community. I'm just putting something, but maybe it's not the reason. So that might help you if you don't need those vehicles. You might say, okay, what we need here for our SRS is just to get like a motorcycle for like all our data collectors. So might be, I don't know, 30 VA data collectors, and those will cost maybe $3,000. I don't know. So and we need bicycle for all of our community workers. And those might cost, I don't like this kind of information. You might think about really what do you need for people to move to get you the data you need. Think about office and furniture. Maybe this is run by a government institution that already have some chairs, some stuff there. Maybe those will be zero, and you just put some comments as you want it there. For office renovation and restoration, some countries might have at national level some buildings that are already available that was provided by the government to have the SRS team to be there. So that might need some renovation. You can think about of renovation you might need there. And also even at provincial level, there are some government buildings that may be available for your provincial team or regional team to stay. So think about those costs and see how those costs might be useful for the system. So you can still add additional line if you need for each of those one, or add some additional budget items you need for infrastructure. So this is just a template that helps you to start thinking about the budget you need. For technology here, also think about, as I mentioned here, printers, laptop, desktop, whether you need to put like desktop for all provinces, some laptops, some printers. For software also, what type of software is used, database, generator, whether you need some solar charger, think about all of them, and really tablet covers, projectors also, so, and smartphone. Those are really important for data collection. So really think about what you need there and make sure that you have those to start the project. For field equipment, so depending to countries, you might think about what community resources you need to provide them for for really moving around to collect the data. Here you can see here we put some t-shirt. In other presentation we showed you those t-shirts we put for each of the level, for central team, provincial team, and community team. So all of them have some type of t-shirt they need, some backpack, some hat, plastic bag, and some raincoats that was provided mostly to the VASA data collectors to make sure they can move during the rainy season and collect those ones. And also some, if you use motorbike, make sure that you have those also there. Regarding the training here, the training, what we did here is to first have a training of trainers, mostly the central team and the high-level provincial staff. Sit for 2 weeks, discuss all the procedures about the data collection, discuss how it will be feasible, and train them for each of those tools we have there, and revise it and make sure this is what the country wants. So we have this training of trainer. Then after that, we have like a training of interviewer, like mostly the community workers and the VASA trainers and the VASA interviewer. For VASA in Mozambique, we have right now we have I think like about 50 data collectors. So in general, you want to collect 50, and you might add maybe 20% of the to add additional trainees. So to make sure that you train them carefully, and also have some back of data collectors that are readily available if you need them to go and replace any data collector. So for Mozambique, as I mentioned, we move all the selected interviewer for VASA data collectors to come to Maputo for a training that costs more money, but at least was efficient to make sure they get the same trainings, because sometimes some people, if you do decentralized training, some might get more information to others. But if you do that kind of training, make sure that you train all trainers at the same way, and make sure they understand the same resources as they go for other training. Even for training of community workers, we also did that by province, where we ask all in community workers, like when you go back to the slide, let's say you select a province of Zambezia, have like 118 clusters. We ask all the 180 community health workers selected to come to the provincial capital for a week training, where we go through all the procedures and also provide them all the resources they need before they go back to their communities. So think about what you need for your SRS and put some cost there. The cartography, really important, because most of the countries that we are talking about here, the last census was done like several years ago. If you use the census to do your sample size calculation and select your clusters, you really want to make sure the community that you have selected have clean boundaries, and sometimes better use the cartographer to go back and do the work. Countries also have some cartographers that are located at the National Statistics Office. You might see what the resources you need for them if you want to do the cartography, and also make sure they go back and redesign all the activities you need before you start the project. So here is just some of the template we share with them to work on the budget, like training for cartographer. They need to select some of them, train them, and also field work, what really it takes for them to go on the ground, to really do the work, and also the supervision to make sure that in each of those provinces, someone is the supervisor and go select some of those clusters and do it again to make sure everything is clean, and also kind of logistic you might have there. After they finish the cartography, you might think about right now, how do we get the baseline household listing and populations? Either you will use already the community workers you have in place, or the VASA data collector, or an external team to do the work. So think about field activities, the supervision budget. You can add any of those information here, and also logistics. So this was prepared for us really to know how much we spend for each of those lines. As I mentioned, some information might not be relevant to your SRS. You don't need to follow this as like your guideline. You can change some of those things. For instance, we have your community guide, because for each community we want to pay like if there is any payments that we need to provide to the community, sometimes you don't need to pay them, but those were helping people really to go around, because this is the first time they communicate with the communities. And if the CSA was not in place to help them move around and really better understand what was there. So we have it there. Formative research is very important, and I really, depending on what you want to do, really you have to understand the context of the study, how to report, who should be the right person to collect the data. If you are thinking about community surveillance, like who will be the best appropriate person to be recruited as a community workers to make sure that this is the right person you put in this community. In Mozambique, we did it, and it was really useful to understand how the community want to report their pregnancies and who they want to report that pregnancy, because all of them might not be the same. Do not want to provide the same information. And also something that was really important to us was really to understand when is the appropriate time after the death to really do an interview. For instance, 2 weeks ago, we went to a country where we have been doing some VASA training, and it was really hard. They did not have this kind of information. And really, during the pilot of the VASA, we went to do many deaths that even people were in the mourning period, or even the dead person was not buried. And really, it's really challenging. So it's really important really to understand all those contexts. We have in the system here, as I mentioned here, we have developed a template here for not this one, the community, the proposal for doing a formative research. It is probably here. I don't remember. So you can find it there and really see how it was done. Yeah, the formative research. You have the protocol, you have the tools that you need for formative research. You can take it, revise it, and really see whether the question we asked in Mozambique was really relevant for your SRS. Some SRS will start using directly the CRVS. Maybe those are not relevant. But if you really want to have like a in SRS, community-based surveillance, you might really think about identifying pregnancy, birth, and death, how the community will help you to learn about those best practice. So you have some tools that are probably useful here for your SRS. So this is what we have there for the formative research. You can think about the budget. So this was done by an external consultant we have in Mozambique, because we couldn't find someone from the National Institute that were available at that time to do it. So we recruit an external consultant to do it. For your SRS, you can think about if you work with the university or like some national institute there that are there and already have the staff to do the work, maybe just to think about what is needed for your SRS and why. So this is the first budget we have developed for you to help really understand the startup costs you might have in your budget. So if there is some burning question, I can try to reply those quickly before I go to the next budget, template of budget that is related to annual recurring cost. We still have 25 minutes, or I can go quickly to this one.
Yeah, maybe
then
Malick,
after we can open. Yes.
Yes, I think it would be probably better if you like present them all and then we have a discussion.
Okay, so this is the same idea you have there, like README, summary, and the summary, as I mentioned, will give you all the information related to each of those sheets here. So something that we add here for the personnel here, for some countries, I know they are using their local currency. For Mozambique, for instance, I think it's about 60. If you add here 60, you can think about you need maybe one project manager. The unit cost on the local cost, I don't know, is probably, let's say, $6,000 or 60,000 probably. So you can hear something like that, and it will calculate all the information in dollars. So we did it only for this one, is to give you an example of what kind of information can be added in your spreadsheet. So if you think this is useful for your spreadsheet, you just need to use the same template here and add it here. If you don't need the local currency, you will go directly and write the money in dollar, and it will go through the calculation. And as I mentioned before, all information will come directly to that template. So you will think about what do you need for central team, the personnel you need there. So we also provide you a list of key people that might be recruited for central, provincial level, and other personnel here. For central team, we think about a project manager, some assistant, data manager or several data managers, admin, financial. The financial is really important because it will help you really design all these the expenses and the budget you might need, and so some contract manager and some HRS. So yeah, it is important because you're gonna recruit so many people there, contacting them. All this might need really some people that might help. Maybe they are not like 100% or they are already available in the government system. You want to use them for this work. You don't need to budget or just see the kind of budget you need for them. Regarding the provincial team, it is important if you have like a provincial coordinator, a supervisor, some VASA data collectors, if you collect causes of death, who are the community workers, and also if you need even some data managers at the provincial level. There might be not like 100% in the project, but if like you are using a national health or national statistics office, they have some buildings, and sometimes they have like regional or provincial data manager that might be useful to really look at the provincial or regional level data and provide feedback as they come. So think about if you use some car, you might need some drivers, some cleaners, all that kind, and also other expenses. Since those are contractor, maybe you might need some medical expense, travel leave, and all those benefits are really important for the field work. One of the most important thing also is about data collection. What really do you need for data collection about the field work, the jam, the vehicles, the gas, fuel, communication for them. For instance, in Mozambique, depending to the level of these workers, the central team will receive, if I'm not wrong, maybe $30 per month for communication. The VASA team, I don't remember, maybe 20, and the CSA $5 for communication to collect data using their tablets and send to the cloud server. And also they will use it for internet, make sure because they have some WhatsApp group. So it's really important to think about the communication. It's the same also for supervision. What do you need? And some logistics still need some papers and all this. The data collection template should be, you can add additional information that are relevant for your work activities. Refresher training, we recommend to have some refresher training because you train them once to start the project, and if you can do that every year to bring all of them in the same place, or do some regional trainings to bring them, discuss about project and any additional information you want to collect on your SRS, you can add those one also. And challenges, resources they might need to really do the work. So you can think about some refresher training for trainers, for interviewers, and for data collectors. You might say we don't need it, we just train them once and they have to do their work. So if this is your design, you don't need that shit, but we really recommend to bring them annually or biannually, at least to discuss about the tools and challenges and all that. This is like a process. They have this kind of, for the community workers, for instance, our VASA team will supervise them, and every time they go to those communities to do VASA interview, they will meet with them, discuss challenges, and help them really if there are any issues on the ground, and strengthen their activities. And also they have to communicate with them at least once a month to really to discuss. Sometimes they are not doing it, but this is something that you can discuss whether it is useful. The annual population update or biannual, still if you go to the same website I showed you before, you can see here there are also some resources about baseline mapping. Sources, you can use all of them, and also think about the data analysis and annual. If you come here, you can find the resources you need for the protocol for annual update of the population, and also whether you want to go through that kind of data collection to make sure you have your annual population updated, so to help you calculate your indicator to have a clean denominator, as we said. So think about training you need there, and data collections and resources you all need. And also the logistic, as we said, is really important. So you might not need to do it all the time. So for instance, for mobile phone, what we are doing in tablet is to make sure that every 2 years we replace the devices. So this is something that you can think, you can say, okay, in our project, we need to do this every 3 years. So to replace all phones and also have some backup of phone. For car maintenance also is something that you can see what is the usefulness of this. And for also vehicle insurance on a monthly basis, data captures. Here we are using some cloud server. We have to pay the fees every year, and also buying toners, printers, bag, shirt. All those are replaced on a biannual basis. And also for communication, as I said, think about how much do you need for the VA data collector, the central team, the SA on a monthly basis. Workshop. The workshop for dissemination, you might think about the National Advisory Group meeting once or twice a year. How much do you need? And also have like a national stakeholder meeting where you invite all stakeholders to come and show your results and discuss how this is strengthening the country data system and what type of information might be relevant for the country. If you have some data workshop, this is also useful because every year you want to have like your annual report published. Think about getting the people around to really look into the data on a biannual, like every 6 months, and also start writing the annual report and all this, and writing some scientific if you need to, and attend some conference. I think this is overall what we have here. And also, yeah, some bank fees. Sometimes we forget that one, but you know, if you ship stuff from other countries, think about shipping fees, bank tenders. Those are not too much money, but think about those ones. I think this is overall what we have here for the sheet. So as I mentioned, you can go through the website and get most of those template budget and read the paper and see whether this is useful to your SRS. As Daniel mentioned before, you can think about the design you have, whether you need some of them, and think about, as we said, do we need all those personnel to be in your SRS, or you already have some staff on the ground if you are using, I don't know, health workers or CRVS workers to help you with data collection or whatever. So it is a template, and we wanted to share with you what we have developed and how useful it might be for your SRS. I will stop here. Thank you.
Well, thank you, Malick. Super interesting and super comprehensive toolkit, let's say. There are a couple of questions already in the chat. Maybe I can bring them to you so that you can maybe give some quick points. So one was a point on in-kind support by government agencies, like for example, like what we're saying, like there were Agbesi was saying that there were some personnel, some cars that were provided by the government. Whether you estimated the cost of those or you left them out. Agbesi mentioned that they were left out, but I'm not sure if you would recommend to do it for countries if they should kind of monetize the contribution of the government contribution or not.
Yeah, here it depends. Some country, like if you use like the statistics office, sometimes when they do like some surveys or some census, they already bought a lot of cars there that might be provided to at the end of this activity to some offices or some provincial level. So you might think if those are available, fully available for your system, probably you can use them. But if it is just for you to start something and they will take it back, you don't know when you are going back to the field, really that might be a problem for your system to run smoothly. So depending on the design, so if really sometimes we can use some cards from those offices when we want to do like our annual update of the population. They can provide those kind of assistance for like short term. They will tell you, oh, we have those cards that are available for you just for like 1 month. You can use them quickly and do your data collection and send them back. But if really those cards are not available for your project to go do the data collection, supervision, all this, maybe think twice before you take them, because you might have an activity and they said we need our car, and you are stuck there.
Okay, thank you, Malik. I don't know, Kubesi, if your hand was around this topic or a different one.
Yes. Just I mean, what Malik said just on point. And this is in cost in budgeting. In doing your budget, it's important to see what in kind contributions are there. This is meant to be a national system that is, institutionalized in some way, and so whatever resources are already there that can be tapped into. Sure, especially not at central level, but at the within the country at regional or provincial level, what are resources that can be drawn. Now, the question that my friend William asked was about the costing. So if you're costing, then the whole thing, it's just a different matter, because then you want to see whether in-kind resources should be converted into monetary item and cost included in the costing. This has not been done in the paper that Malik presented, because it's just difficult to really transform the costing on offices and random allocation of vehicles and so on into money. So those the costing then might be slightly underestimated, but keep in mind those that don't include the in-kind contribution. However, in your budgeting, it's important to see what's the contribution from various departments that are interested in the SRS. Thank you.
Mm-hmm. Thank you both. I'm gonna go to the next, for the sake of time. So Malik and Akbesi, there is a question also from Williams on exchange rate, and he's asking about in countries where the fluctuation of the exchange rate is high, how do we do it?
Yeah, that is a question that has been asked so many times, even not in this project. Sometimes you budget for 2 million and the exchange rate change slightly. You run your project and you discuss with country how it changed. But here is just the exchange rate you use at the beginning of your project. Sometimes, as you can see in Mozambique, some months the exchange rate might slightly change, lower, higher. So that it's really depending to the country, is really to discuss. But this is what we have at the day of the submission of your budget. Sometimes it might fluctuate slightly, but those are not something that you can really deal with this for now. So I think what we have in Mozambique is the financial team sometime might say you, oh, when we submitted that budget, we allocate, I don't know, maybe $100,000, and it has slightly increased or reduced. So they might see, okay, let's probably use this line in the budget to really complement or add additional fund to make sure this activity is done properly. So those are not something that you want to control, but it's just the day of your submission, you will use the exchange rate that is available there, and this is the money you will get. Yeah. So I don't know if someone want to also discuss more about that one.
Yeah, also there was a comment from Akbesi. I don't know if you want to mention it, like basically is to discuss it with whoever is bringing the funds, like to know what they want, like what is their like policies and and their approach to exchange rates in situations where exchange rate can fluctuate. But anyway, there was another point on French translation of the tools and the materials. Oh, Agbesi, I don't know if you're talking. You're on mute.
No, just to say, Ronald has his hand up.
Yes. Okay, I was just reading finalizing the chat. So the tools on the French translation.
Yes, so that's a good one. So we are still thinking about translating everything. This is not yet done. Is our next probably assignment for the activity. So yeah, it's something that we should some resources to translate all the tools. Some of them have been translated, but not all of them. Okay. It's something that yeah, Kelsey, our program coordinator, she's around and we'll take note of those. So it's something that we have to work quickly on those ones. Thank you.
Okay, perfect. And now Ronald, please.
Okay, and thank you, Daniel. Thank you, Malick, for the presentation. It's not a question for you, Malick, but actually comment. Actually, I'm speaking from the experience of COMSA Sierra Leone. The running cost, of course, is pretty much the same, which is approximately $1 million a year. But then there are two significant differences I want to point out. One related to the startup cost, because we didn't need to procure vehicles. And the second point is that we did physician coding. So I want to speak to the physician coding aspect. It's important. This is a strong advice to all countries. It's important that you budget for physician coding. In as much as algorithms are pretty good, but then in terms of research evidence, the agreement to the gold standard or even to the silver standard is only about slight to fair agreements, the concordance. Okay, so what we recommend, I mean, when you're doing verbal autopsy, is to use physician coding, and then the algorithms and OpenAI GPT-4 can also give you that guide or that support. For COMSA Sierra Leone, each code, each narrative that we code, it's $2 per record. It's $2 per record. So we all need to understand that if we go through all this work, this project, and at the end of the day, you don't have a credible and reliable cause of death data that would inform budgetary allocation, policy, and practice, it will be an issue. It will be an issue at the end of the day. So we need to understand that. We had up to 12 physician coders, because for every record you code, you need at least 2, because it's dual physician coding. And if there's discrepancy in agreements, of course, you need a third person to adjudicate. So I'm strongly advising, okay, that you budget for physician coding so that you'll be able to experience that and have a better cause of death data. Our experience regarding the vehicles, since we worked with MOHS, and most of our social mobilization was done through the district health management teams. Okay, so at the district level, the DMO and team was there to follow through with the SOCMOP and also engage in supervision. So we had access to MOHS vehicles and bikes, but then we mostly had to, with teams in the field, we had to rent boats for riverine areas, rent bikes, mostly for the team. And when CAs come in country, we can rent vehicles for a short time. So that's how we were able to beat down the cost when it came to vehicles. And it was good because when you're working with a government entity, you also have that access. And I was there to ensure that I worked with all the MOHS team members so that we could reduce on that area. So mostly it was providing the fuel for MOHS vehicles and bikes when it came to that aspect of supervision and, of course, meetings and social mobilization. But then strongly the advice is please for the teams to really think about bringing on board physicians and doing the coding. Over.
Thank you so much, Ronald, and very interesting point. I don't know, Malick, if you have any reactions in the 2 minutes that we have left.
Yeah, no, thank you.
Yes.
Thank you, Ronald. Those are really great points. So as you mentioned, I think you are working with the government, and this is a project that should be run by a government institution. Anything available for your project to run at province, central level, use it, bicycle, whatever. So for the physician coding, country will decide. So they have like some team they need to assign there. You know, physician coding has been there for so many decades. They have their issues. VASA algorithm have their issues. So country will decide what is really useful, whether they want to hire a physician to sit there in the office and do the coding. You provide good idea on how much it costs for the SRS in Sierra Leone. We did not have those costs, but you know, as I said, physician coding for VA have been there for so many decades, and country will use what is really useful. Using an algorithm is not saying that the VA code is not valid. Most of countries have been using InterVA for almost two decades now. They know how it works in SIS-COVE. The physician also coding when you put there. People will just discuss about the results, and we all agree about those one. Know what you can do with physician coding, what you can do with algorithm, and country will decide what is the best appropriate for their design to use here. Thank you for all.
Thank you, Malick, and thank you all for the questions and the presentation. So I think we have 2 minutes to the end of the webinar. I don't know if there is any last burning question or comment. If you have questions or comments after the webinar, please make sure that you say, oh, Philip, yes, go ahead, please.
Yeah, just briefly, I mean, does it make sense? I asked a question earlier about the inclusion of technical assistance costs. Does it make sense to include those in the template itself? Because those are part of the true costs of establishing a system. Over.
Thank you, Philip. Malick?
Yeah, this is like this is the country budget. So if they think they need some technical assistance, they can share like a template budget for the technical assistance they might need and how much it costs. It's I think it's okay to add those templates for them really to understand how much it is useful. But this was like the true cost of the Mozambique system that we have there, not including the technical assistant we had here. Thank you. But it is important to take care of all those costs also. Thanks.
And important to know that often country will not know the cost of the technical assistance per se. So that's why those are not included there. But if you know them, then probably it should be a separate spreadsheet in your budgeting. Thank you.
Thank you, Akpesi, Malick, and Philip, and probably because with budgeting, just a point from my side, with budgeting, it's probably useful to know who is funding what, because probably some of the costs will be funded through different mechanisms, and maybe technical assistance is one of them that might come through a specific mechanism. But anyway, if you have further questions or comments, please send them to us. Send it to the technical assistance mechanism or through the country focal points, and we will make sure that we channel them to Akpesi and Malick in Hopkins and make sure that you get your answers. Just to say, the next webinar will be is planned to be on the 4th of August, so in 4 weeks. So we have a monthly webinar. So the next one will be the 4th of August. I don't know if people will be around. We will reconvene a bit internally to see if it makes sense to do it in the 4th of August or maybe doing it a bit before that or a bit later than that. But yeah, in principle, it's in our calendars for the 4th of August, and there will be a fantastic topic like the one today. I thank you, Malick, for the presentation and all for the questions and comments. And yes, see you in 1 month, the latest.
Yeah,
thank you, everyone.
Bye.